Good afternoon. I'm Jeffrey Jones with Universal Family Connection. You're here with another edition of our monthly show. We're talking about HIV and risk reduction. I'm joined here with my colleague, Lade Ademosu.
Yes. Good afternoon. This is Lade Ademosu from Universal Family Connection Risk Reduction Department.
Okay, Universal Family Connection is a 45-year-old agency. We're located on the south side of Chicago, 1350 West 103rd Street. You can also visit us on our website at www.ufcinc.org or universalfamilyconnection.com.
We also have another office on 7949 Southwestern, where we have other programs.
Right, and you can visit us at either one of those locations.
Yes.
But here today, what we do on a monthly basis is we talk about sexual health, risk reduction, HIV, especially hepatitis, and we talk about it from the standpoint of helping folks to understand HIV, to keep people up to date, aware that HIV is still plaguing the African American community, especially our teenagers and same gender loving partners. And so what we want to do every month is try to inform you, give you some more information. What Lade and I are going to focus on today for the next 25 minutes, we're going to be addressing living and thriving longer with HIV. We're really reaching out to those long-term survivors, folks who have been battling and winning against HIV for the last 10, 20, even 30 years. And so after 30 years, as you get older, HIV doesn't remain the most important threat. Now you have to start dealing with what we call comorbidities. And what Lade is going to talk about, those comorbidities or some of them, and how you can address them in terms of living longer, in terms of not being plagued by some of the side effects or symptoms of these comorbidities. Go ahead.
Yeah, as we know, people living with HIV live longer.
Much longer.
Mm-hmm. But chronic illness like heart disease, diabetes, and mental health issues are becoming more greater than expected. It's becoming a bigger concern right now. So research is focusing on how to best manage these comorbidities in conjunction with HIV treatment. Saying that there are deeper drive into research, like I said, about how to manage, and along that side with HIV treatment. It is known that the drug interaction research is a factor too, because research is ongoing to identify potential interaction between antiretroviral therapy and ART, as we call it, at medications and medications used for comorbidities. This helps doctors to choose the safest and most effective combination for individual patient.
Okay, so you say that's the research that's going on.
Yes.
Right now, in terms of just looking at how many pills they're giving a patient, so you don't have to experience as many side effects. And then the interactions with the other drugs. So if you're being treated for heart disease, if you're being treated for diabetes, if you're being treated for, I know some of the clients we served had COPD. So there are a number of, as we stated, comorbidities or other diseases that come along, not because of HIV. So many of our clients and the people that we interact with, they maintain their HIV very well. They're considered undetectable.
Yes.
Therefore, they can have unprotected sex and it's untransmittable. So they're managing their HIV Very well. So it's not a factor in determining whether you'll get a chronic kidney disease, whether you will get, like I said, stated diabetes. And so that research is trying to focus on making sure that whatever medication your specialist might give you for the chronic kidney disease, so to speak, or the diabetes doesn't interact in a negative way with the HIV drugs.
Exactly. And that's how the reduced pill burden is a factor now. They are developing long-acting injectable ACT, which is an antiviral therapy medication, which is a major area of focus right now. This can improve adherence in people, especially for older adults or those struggling with daily pills. I think it's a great thing that there's I know a client who has gone for it, and she's doing well. She said, I think it's once in every 6 months.
Okay.
She said, yeah.
Okay.
She said it's really, she felt nothing, no side effects so far.
Okay.
Yeah.
And see, that's important. See, so let me tell you why this is important. Because some of the clients or folks who are fighting HIV are not always aware of the newer research. Sometimes your doctor gets you in and out. You get those 15 minutes. You run your blood test, and sometimes you don't actually know what's going on. So what we're trying to do is let you know that there are other alternatives. If you've been taking, say, a pill, couple of pills. So now they've reduced the pills from maybe 3 pills, 5 pills, to down to 1 pill. Okay, that's for that's something that you can talk to your doctor about. That say, hey, I don't want to take as many pills. Can I be? Can you switch me to the 1 pill a day? Okay, some of the folks are actually taking 1 pill a day, but now they have what you can do is an injectable, and it's called a long-term release or long-term acting. And what it does is it allows you to come into the doctor like every 3 or 6 months, where you just take 1 shot, and then you don't have to see your doctor for several more months. And so that's really important because now you don't have to remember as much every day. Sometimes we have clients that talk about they might forget to take the pill at a certain time. Yeah. So if you just have to get to 1 appointment, 1 time a month, I think that's fabulous.
That's great.
Right. So that's one of the things that we want to make you aware as a consumer. Of what's available for you. And as a long-term survivor, somebody who's actually been dealing with HIV, like I said, 20, 30 years, you want to make sure that I'm staying as healthy as I can.
Yes, I can, yeah.
And so that's one of the things that we want to, we continue to talk about is what's available in terms of HIV treatment currently. So also, what else, Lade? What do you?
So that being said, the comorbidities specific considerations. The research is studying how specific comorbidities might influence the choice of drug that you want to take. So they are putting that into consideration as well. For example, some medication for heart, like you said, heart disease may interact with certain antiviral drugs. So they are putting all that into study now just to make sure the heart condition is not affecting HIV infection or affecting viral load.
Exactly.
Which is great. So study is going on. There's always hope. There will continue to be hope. Just follow your doctor's instruction, and if you are tested for this injection and you feel like it's affecting you negatively, go back to your doctor almost immediately.
Exactly.
And, let them know.
That's why tune into our show every first Wednesday. We want to empower you. We want to share some information. We have a support group. We meet for people who are HIV positive. We meet every week from 10 o'clock in the morning to 2 o'clock. You don't have to stay for the whole 4 hours. We serve a nutritious, delicious lunch. Oftentimes, we serve some nutritious, delicious breakfast. Our clients enjoy it so much that sometimes they're there before the door is open.
Yes,
that's because we get a lot of encouragement from each other.
We enjoy seeing them anyway.
Exactly. So we're looking forward to them getting there, and they're looking forward to being there and seeing their other associates and friends. And so it's a really, really welcoming atmosphere. That's every Friday from 10 o'clock to 2 o'clock, or 10 o'clock to 2. Sometimes we leave at 1 o'clock. But you're going to always have a great time. You're going to always have a great meal, and you're going to always get some good information. And so that's what's important.
This is at 1350 West 103rd Street office.
Right. That's and that's in the Beverly area. We're easily accessible by bus, train. The 103rd Street bus stops right at our door. So if you know someone who is HIV positive and who would like to attend, give me a call. Give Lade a call. Our number is 773. 881-1711. Again, our number is 773-881-1711. And you can call in. If you need an HIV test and you get those results, we do the Alere confidential test. You can come in 9 o'clock in the morning, call me up, say, Jeff, I think I might have been exposed, and I want to come in for a test. I'll get you right in, get your information. We'll get that test. You'll get your test results back in about 15, 20 minutes, and we'll talk about it. We'll do some, give you some instructions or advice, more or less, on how to make sure that it doesn't happen again, that you remain negative. One of the things that you can do to remain negative is what, Lade?
Is to continue to protect yourself, like wearing condoms.
Wearing condoms.
Yes, and
also we have out, I know a lot of people still don't know about it because we ask PrEP, pre-exposure prophylaxis, PrEP. Ask your doctor if you know that you are exposing yourself, if you're having high-risk sex, and it's not a judgment call, and we want to name it, but if you know that you're the person that you don't use condoms and you know that you are engaging in sex that could expose you to HIV, you probably could benefit. You will benefit from being on PrEP. You can go there to your doctor, and they'll set you up for it. Call us, 773-881-1711. I'll refer you to the great doctor that will get you in, do your evaluation, make sure that you have not been exposed, and you can continue on staying negative.
And if you have sex without planning it, you can go to any emergency room for PEP, which
what is PEP?
Active,
what is PEP?
PEP is post-exposure pill that's prophylaxis.
Right. And what does that do?
It does prevent catching the virus before it's too late.
Right.
But provided the person goes in to get it after having sexual unprotected sex.
Exactly. You need to be within 72 hours. You need to get there right away if you know that you even have an inkling that you might have been exposed. And so we just here, like I say, this is an empowerment. This is not a judgment. This is not to scare you. This is to inform you that HIV is still real, that it's affecting our community, especially African American communities. You can go on the website, cdc.com, and just look up some of the research about how HIV is affecting the African American community, and it'll show you that what we're talking about is real. And what today we're focusing on is long-term survivors, folks who have been, who HIV has been living with them, who's been thriving and taking care of themselves and making sure that they see their doctor and that they're managing their HIV and that they're doing the things necessary to remain healthy. Because at one point we know that HIV was almost like a death sentence. 30 years ago, 35 years ago, folks were dying literally within months of knowing that they were positive, and we had no good treatment. But now we have extraordinary medication that can keep you alive. And I know a lot of folks, blacks, people especially, we think about the Tuskegee studies and we don't trust the healthcare providers. And you have a right to question everything. Question your doctor about the medication, the research, about the vaccines, anything that you're putting in your body. You should not make a rush decision. But I can tell you that many of my clients who have been around for 25 years that I've had, and they come to our groups, they tell us that they have experienced no side effects from the long-term taking medications for the last 20 years. So you can live with this disease. You can live a normal life, have clients who have gotten married, had children. Some of them are actually working on grandchildren now. So don't hide, don't allow the stigma or people who still are uninformed about HIV scare you from getting your test results. We think it's better to know than not to know, so you can start getting the treatment. One last topic I want to cover in the last few minutes that we have in terms of long-term survival is lifestyle modification. And we're talking about as you get older, and this is not just for people with HIV, this is for people like myself. I'll be 60 in September. So some of the, I feel pains that I don't know where they come from and just show up in my knee and sometimes in my lower back. I'm like, God, I haven't worked out. What is this? So lifestyle changes, what you eat, walking around the block, getting a little exercise. You should walk around the block. You could walk around the block. You don't walk around the block. You could eat the apple a day. You should eat the apple a day. You don't. Instead, you eat a Snickers every day. And so those things take a toll. And so what we're trying to encourage older and younger folks, but especially our older clients, to talk about lifestyle changes. And one of them starts with diet and nutrition. Do you know a balanced diet will help you live a little longer than you would if you didn't stay on the diet, if you didn't eat the right foods. These balanced eating, if you talk to your nutritionist, really focuses on a balanced diet that's rich in fruits, vegetables, whole grains, lean proteins. You need to find out about these things. It's not just trying to lose weight or anything. It's just giving your body the optimal nutrition. That's what I'm saying. That it needs to build up overnight when you sleep, to rebuild after you've done your 1 mile walk every day. So you need to make sure that you are doing these things that help you remain healthy. It's talking about your nutrition helps you to maintain a healthy weight and supports your immune system. It reduces the risk of chronic diseases like heart disease and diabetes. Your nutrition will help your body and your immune system to fight off diseases that would otherwise start to affect you, that would maybe clog your arteries up, to raise your HDL, cholesterol levels. So those types of things. Also, nutrient-dense choices, which prioritize nutrient-dense foods that provide the essential vitamins that you need, vitamins and minerals, especially those that might be depleted by certain HIV medications. HIV medications sometimes will deplete some of the vitamins and minerals in your system. And so your proper diet, you got to take all this in consideration. Vitamin D for bone health and vitamin B for energy and metabolism. Sometimes HIV medications can affect those. But a proper diet, not donuts in the morning, but some fruit and some vegetables, some broccoli, some cruciferous vegetables, broccoli, cauliflower. You can look all of this up on the CDC website, or you can just start to Google it and find out what foods that are most beneficial for long-term survivors of HIV. Just put it right there in the Google search. I'm telling you, it'll show you all of these. And then you need to, whenever you see your doctor, if you don't have a doctor that attaches you to a dietitian, find you a new doctor. Say it again. If you have a doctor that does not refer you to a dietitian within the hospital or sends you out, you need a new doctor, because they're not focusing on your holistic approach. They're just focusing on giving you medications. You need more than that at this point.
And for those people who are, some people are set in their ways about eating, you can try Ensure with low sodium, and it will give them all those benefits you are talking about.
Say that again. What's
Ensure.
the name? Okay.
Ensure, the liquid drink.
Exactly.
It has all the enzymes, all the vitamins, and
all the minerals that you need. And it comes in delicious flavors: vanilla, chocolate, strawberry. So if you're not one that can always eat healthy every day, we want to give you some alternatives. Tune into our program every Wednesday. We're here at 4 o'clock to 4:30 to provide you with this information. This is Jeffery and Lade. We're from Universal Family Connection, located in the Beverly area, 1350 West 103rd Street in the south side of Chicago. And our other location is
7949 Southwestern.
7949 Southwestern. Okay, so we're going to wrap it up in about 5 minutes, so we want to make sure that you are aware of what we went over today. Talking about long-term survival with HIV, fighting against those comorbidities. What are those comorbidities, Lade?
They are like the drug intervention. Intervention, interaction. Drug interaction from the antiviral therapy to what is really going on in somebody's life. Those are the things they are working on. And comorbidities are heart disease.
Exactly. Heart disease, diabetes, mental health. So some of those other things that come along as you age, not from HIV, that comes along with HIV. It just comes with age, and so
weakness in the body is part of it. Weak bones.
Exactly, all of those things.
Old age.
But you can fight this from nutrition, lifestyle changes. Get out and walk. Join some groups. Come to our group, man. You're talking about mental health therapy, just to laugh. We listen to music. We plan trips. We have a consumer advisory board there, and this is going to be a really great summer for us. We're just getting us a new medical mobile van. We're going to be out testing in the streets. So please come and join us, lend your voice. If you are an HIV positive person and you're mentally positive, come on in and share your energy with us. We would love to have you there. Also, we're talking about consulting with your dietitian, getting those physical activities in, getting your steps in, doing those things that are necessary to help you live long. We know you're not going to live forever, but why not live a great life until it's time to leave here? Why not stay as healthy as possible by just making a few moderate changes, cutting back on the alcohol, cutting back on the smoking. That's another thing. Smoking, we can help you with a smoking cessation plan. We can even help you set up a alcohol diary so that you can actually wean yourself off alcohol. We have substance abuse at our agency. We have job readiness programs. We have the CTA Second Chance program. We have what other programs?
We have drug and alcohol program, counseling, which is for mental health.
Mental health.
We have big area of child welfare. In case that could be a problem for you, you can seek help. Your child doesn't have to be in care of the state for you to get service in that area.
Exactly.
It's very wide.
So we have an array of programs, great staff, welcoming staff, very professional staff. Come in, visit our facility, give us a call, come in and get a free HIV test. We're going to be having a great summer camp for youth. Please call and find out more about us. We're at 773 881-1711. Again, our number is 773-881-1711. We're located in 2 locations on the south side, 7949 Southwestern and 1350 West 103rd Street.
And don't forget, early detection to these comorbidities is very, very important. So it is very important that you alert your doctor if you feel anyhow, especially people living with HIV and old age. So,
thank you so much for tuning in today. Once again, Jeffrey Jones, along with my coworker, my colleague, my friend, Lade. Thank you for tuning in. Thank you for our production team here at KNTV.
Thank you.
We couldn't do it without you.
Thank you.
And that's going to be, we wish you have a great day. Enjoy the rest of your evening. Get out and enjoy some of that sun that we're having here in Chicagoland. I think the weather on the way here was almost 80, right? Yeah.
Yes,
So get out and enjoy some sun. Get that walking in. Like we said, get some vitamin D on your skin from the sun. And we will see you back here next Wednesday, the first Wednesday in June. Please come on back and visit us.
Thank you.